The psychosocial perspective for this afternoon that we have at the European Lung Cancer Congress will actually be focused on three main issues, which is about war with cancer. That is a very meaningful thing that we have done in the past because, it helped us to move from a very tumor-centered oncology to a person-centered oncology and from the patient to the survivor. So we are going to talk about the war on cancer, which has been very meaningful, but we still need to beat cancer because, the prevalence is going up, but also the survivorship data are also on the rise. So that's very clear from the data that we see that the need for psychosocial support is going to increase in the next period based on what we see now on this beating cancer landscape in Europe and around the developed world as well. So the first thing about the cancer burden and the war on cancer and how it relates to the psychosocial needs that are going to emerge and increase, and we will have to, of course, find a management of these needs. The second part of my professional perspective on the psychosocial needs is about caregivership, because that's almost certain that in this war with cancer, almost all of us in our adult life are going to be impacted. So cancer caregiving, whether it is a formal caregiving with professionals or an informal or family-based caregiving with family members, friends and relatives, it's a very important part that we should tackle with our professional perspective, because cancer caregiving, it's a very significant cause of distress in the cancer journey. So I'm going to talk about this, and most especially I'm going to talk about the kinds of interventions that can help us to ease the distress and to modify the distressing cancer experience. And I, of course, will touch upon new highlights in interventions like the couple-based interventions in caregivership. And also I will try to highlight those interventions that are closer to the lung cancer experience, like experiences that are building on the self-efficacy, because self-efficacy and very valid and reliable personal self-efficacy, it's the best tool that we have against the stigma, because lung cancer patients and their relatives are facing stigma related to smoking unfortunately, in more times than it should be. And the third thing, beside the cancer burden and distress and the caregivership possibilities and opportunities, will be about the change. What does it mean in psychology, in the psycho-oncology and psychosocial perspective? We very much want to understand through our research those parts of the cancer experience that we can help modify and that we can help to control or manage it. So as I just told you, I am going to speak in the change part of my presentation about the psychoeducational programs and also about the different techniques that we use to strengthen our ability to accept and also our ability to find the meanings or different personal meanings in our experience with lung cancer. So the three keywords that you are going to expect from my presentation on the lung cancer needs from a psychosocial perspective are cancer distress burden, caregivership opportunities and burdens as well, and also the perspective of change. That means, first of all, the control that you can learn and you can apply when you have distressing cancer experience.